Hi, thank you for that introduction. I'm going to talk to you today about using a complex network methodology to track, evaluate, and transform fundamental care. This work was developed by myself and my colleagues, Tiff Conroy, Alexandra Mott, and Professor Alison Kitson. We belong to the Caring Futures Institute from the College of Nursing and Health and Sciences, Flinders University. Professor Alison Kitson and myself, we belong to the Center of Research Excellence in Frailty and Healthy Aging at Leisa. Let's begin with this exciting method. Okay, I would like to acknowledge the traditional owners of the land from which I am presenting to you today. I pay my respects to their elders, past, present, and future generations. The structure of our presentation. First, we're going to talk about age quality and safety, age care quality and safety as a complex problem. Then complex adaptive systems and fundamental care, the fundamentals of care matrix, which is our new innovative idea and approach, a case exemplar to demonstrate the feasibility of this methodology and the future. So first, age care quality and safety as a complex problem. Here we have next to me Ms. Meryl Mitchell. She provided her statement to the Royal Commission, and we are using her statement as a case exemplar. But first, let's understand age care quality and safety as a complex problem. What we mean by that? Well, as I mentioned, the Royal Commission gave us a perfect illustration about the situations where care can go wrong. They describe, importantly, the lack of understandings and methodologies to actually track, measure fundamental care. What is fundamental care? Fundamental care is defined as the care required by every person, every one of us, for survival, health, and welfare. These care needs might be attended by several different types of people, organizations. It could be care can be provided by a family member, of course, a carer in a hospital, private homes, clinicians, resident care facilities, and many other care settings. So that's why, if we think about the complexity of care, we perhaps understand why we have a lack of ways to understand and measure fundamental care. Complex adaptive systems and fundamental care. So there is a growing understanding of healthcare as a complex adaptive system. What this means? Complex adaptive systems are systems, so different components interconnected with each other, creating complex dynamics. They are difficult to understand. So the aged care system is also seen as a complex adaptive system because it is unpredictable, dynamic, embedded within the healthcare system, the aged care context, and the fundamentals of care requirements. So thinking of complexity, an excellent angle or perhaps an excellent view is provided by the fundamentals of care framework, a framework that have been developed by clinicians, researchers, consumers, all sorts of practitioners and people interested in improving the healthcare around the world. So as we can see here, the framework have different levels and is addressing key and important factors or elements or granular aspects of this complex system. So high quality fundamental care is a complex and multidimensional service that requires a distinct balance between these three different dimensions according to the framework, the fundamentals of care framework. The care recipient relationship, we can see it in green, which involves focus, trust, anticipate, note, evaluate. The integration of care with these subdimensions, the physical, relational, and psychological. The context of care with key subdimensions, the system level and the policy level. So the fundamentals of care framework offers a perspective that explains and classifies fundamental care as a system arranged by three main dimensions, including 5 subdimensions that we see inside the circles, and 38 granular components. Those are the descriptions that we see inside. They are the 38 granular components. So no wonder it's difficult to measure care and to measure fundamental care because science so far has been run by, by linear models when we see one thing affecting another thing and then giving a result or being mediated uh, by different sort of mediators. So we have been concentrated about cause and effect, but as if we understand complex systems, we see there are many causes and effects and dynamics that we cannot consider if we use a linear way of thinking. And that's why complexity science is so important to understand quality of care. Here is our idea. It's very simple, and it's based on graph theory. The fundamentals of care matrix. With the matrix procedure, we use graph theory, which is a branch of mathematics concerned with networks of points, to represent issues or events of care using the statement of this person from the Royal Commission. But we have done 3 statements, and we can do several statements, and we will talk about that. But let's try to understand first how the matrix work. So when any 2 points are linked one or more times, the graph can be represented as a network showing the weight or number of connections between 2 points. So we see here A and B. The issue A, or the granular level, the granular factor A and B connected 8 times. It happened 8 times. So we represent that in the matrix here. We have A connected to B 8 times, and so on. If we put the 38 granular factors of the fundamentals of care framework and the same 38 here, we can understand how they work, they connect to each other at the same time. So this is the adjacency matrix, and this is the network. So what do we do with that? Why is that important? These things can be automatized, and that's the point. We're going to illustrate the kind of information that we can obtain with this network analysis using the fundamentals of care framework. So this is a heat map, basically using the Excel spreadsheet. What do we see here? So we have in blue, relationship. In yellow, we have the integration of care. And in green, we have the context of care. How do we qualify these colors inside the heat map? When you see dark pink, that's excellence. When you see red, those are opportunities for improvement. So using the principles that we described before, we can quantify the frequency of occurrence of intersections or connections, as you would like to call them, between the multiple factors. So how this is important, why this is important? Because with one single view, we can understand what is going on and what is positive and what is negative. However, we can go deeper with this quantification and tracking. So let me read you first the quick analysis that we're providing here. The matrix heat map shows the importance of relationship because we are analyzing a Merrill-Mitchell statement, emphasizing in pink color good practice and identifying improvement opportunities in red color. These care structures and depictions can deliver insight to individuals and institutions at micro level with just one case, for example. However, they can be merged to reflect group experiences, meso levels, and be used to capture extended networks of thousands of end users and therefore predict, model, and alter positive and negative patterns of fundamental care macro levels. So how do we get these patterns or structures? Here is where the network map comes about. Here we are opening the link to the matrix. Since it's open, let me show you quickly the matrix in the Excel spreadsheet. I think it is taking too much time. You have access to it. Oh, here it is. You have access to it with our paper. We have a link, and you can download the matrix and utilize it. Okay. So that was the matrix. Let's move to the network. This network is constructed by a full matrix adjacency table, the one that we just presented, using a principal components analysis with the social network layout from using its software. It reflects the common variance among elements in terms of their frequency of co-occurrence, but it does not consider positive and negative. We already showed them in the heat map. Here, what can we see? We see strong structures affecting each other. These are, in blue, we have the words representing the granular, the 38 elements. In this case, we are representing the most frequent elements and their interconnections. So let's see how we analyze this. I'm going to let you read and take myself out of the picture. So the statement of Merrill Mitchell, analyzed via the Fundamentals of Care matrix, shows the significance of interpersonal relationships across all dimensions of fundamental care when we were talking about the heat map. The matrix highlights the value of contextual factors like resources here at the top of the beginning of the network and culture, having a severe effect on all aspects of care, particularly the integration of care, listening, and eating and drinking, affecting comfort and emotional well-being and relationship aspects like trust, evaluate, and know. We can see in darker color how these structures interact, how these elements interact with each other. The context dimension, the context dimension was affecting the communication, and with that impacting on dignity, respect, being informed and involved, and other relevant connections, which are qualified and structurally reflected via the principal component analysis. So we can gain a lot of insight, but importantly, we can understand these structures, and we can do many things with them if we can do it across thousands of cases. So what's the future? This is the most exciting bit. And I let you to read with me. So this approach can convey, track, measure complex and emotive issues in a quantifiable manner. The gap that we have currently is kind of addressed here. Further development of this method can aid the creation of multi-level solutions. They align goals across individuals, networks, and levels of complex healthcare problems. Our team is envisioning user-friendly fundamentals of care matrices embedded within digital technology using artificial intelligence to facilitate systemic solutions and to improve the health system. The digitalized versions of the matrix are relevant for those who receive, provide, manage, and accredit care. This digitalization will support the many various uses of the matrix, for example, as a self-evaluation tool for caring teams and health practitioners, a quality and compliance tool, a patient and family feedback tool, a teaching and training tool, a care journey tracker of individuals and institutions' performance, and a longitudinal data collection and reporting tool with Bayesian and predictive functions. We are referencing other work where we already have done this kind of analysis and demonstrated how we can predict different structures, behaviors, and patterns that will improve decision making. So these possibilities are investigated by a combination of projects conceptualized, co-developed with healthcare, self-care, and caring solutions. And our research program aims to support better life, better communities, better care, and better systems. I am happy to respond to any questions. Thank you.